Hi, my name is Larry Smith. I work for the Northern Kentucky Health Department, and this is my story. I'm from Gulfport, Mississippi. It sits on the coastline, maybe about 45 minutes to an hour east of New Orleans. I am one of 5 children. Growing up, my mom was a single parent. She did her absolute best with making sure that all of us were well taken care of, like we didn't want for anything. I went to school at the University of Southern Mississippi, located in Hattiesburg, Mississippi. Since I grew up with a single parent, unfortunately, my mom couldn't help me out in college in ways that I wanted her to. But it's not to say that she didn't want to help. She just had another child at home to take care of. So I quickly realized that responsibility hit me. I had to pick up like on-campus jobs. I had to pick up jobs at off-campus, whether that was Home Depot, whether that was working for assisted living facilities, to just ensure that my personal responsibilities were taken care of, while also trying to make sure that I am being a responsible student in undergrad, responsible full-time student, making sure that my studies was taken care of. So I think that work, school balance was very, very challenging to me. Interestingly, I wanted to be a dentist. And after finding out in undergrad, you had to take organic chem. I did not want to do that, but I also knew that I still was very passionate about the healthcare field. And so I chatted with my academic advisor, who shared public health as another option. It looked fun. It didn't seem like I had to take a lot of organic chem. And I knew that I would still be helping a lot of people within the community. It was one day I was sitting and I was just doing Google searches. I knew that I wanted to move away from Mississippi. I didn't want to be in Mississippi all my life. I grew up there. I grew up on the coastline. I wanted a new scenery. So I literally did a Google search and I typed in HIV prevention jobs across the U.S. I applied in areas of Jacksonville, Florida. I applied in areas of Chicago, Nashville, D.C. I saw Florence, Kentucky, and I was like, where is this at? I never heard of Florence, Kentucky before. So in the spirit of applying, I just went ahead and submitted that resume. And what's interesting is Florence was the first place to call me back. The Northern Kentucky Health Department is located in Boone, Campbell, Kenton, and Grant counties. As an agency as a whole, we promote wellness, prevent disease, and protect against health threats. I am the HIV prevention health educator. So what that entails is basically HIV education across the community. A lot of people kind of get it confused. They think that I'm an instructor, they think that I'm a teacher. But really, I define it as just like a community health educator. And so I really help individuals understand HIV, how it's transmitted, ways to prevent HIV. I also conduct HIV testing. I also do hepatitis C testing and education around hepatitis C as well. For any individual who has a negative test result, I refer them to resources around being HIV negative, and for any individual who has HIV positive test result, I connect them with our case management team to discuss treatment options for their new HIV diagnosis. So I educate through just different avenues in the community, a lot of non-clinical settings, whether that be the library, whether that be different schools, primarily NKU, like the college campuses, maybe Gateway. We also have a syringe access exchange program, and so a lot of education is also done there with the participants. So my job is really to just highlight that education piece while also just connecting them to valuable resources around different social services that we may have here in the health department, as well as our case management program. A work day, coming in the morning, I'm probably at my cubicle checking emails first thing in the morning, following up with individuals who may have reached out to me regarding a health fair, may have reached out to me regarding a test result. So really just digging in those emails and responding. Throughout the workday, I'm either being creative, trying to plan different events in the community, whether that be HIV testing events, whether that be me creating my own health fair, whether that be creating something around awareness days like HIV awareness days. There's National HIV Awareness Days. And either working our syringe exchange programs, serving as a liaison for other initiatives within the health department. My most favorite part about my job is really connecting with the community. Is really connecting with, the individuals that I see out in the community, whether it's they come to my health fair, whether they come to one of my routine testing events. It's really just connecting while also changing the narrative around HIV. I think there's still so much fear around even testing. There's so much fear around HIV, and to be in front of someone who's extremely scared, extremely nervous about, what their HIV diagnosis may be, being able to have that opportunity to shift the narrative to get them to understand hey, HIV is, it has progressed. There's new medication out there. Really just kind of changing that tone around HIV as a whole. It really brightens my day. It really shows that the education that you put out there is beneficial to creating that change around people's mind frame and perspectives when it comes to HIV. One opportunity that the public health field provided for me is back in 2018, I became a part of a cohort called BABI, B-A-B-I, which stands for Build a Brother Initiative. And through this program, I was able to meet 20 amazing brothers, and to this day I still connect with them. Beyond getting that professional and personal development, I also gained lifelong relationships, so that was really important to me. Being able to not only network throughout this experience really brought some really wonderful people to my life. And so had I not went the route of public health, I wouldn't have gotten that opportunity to join this very specific cohort. So I've been very appreciative of it. One of the mentors there, I remember him saying that in order to grow, you have to be comfortable with being uncomfortable. And so when he said it, I was like, what? I was like, I'm not following. And so he said, growth comes from uncomfortable spaces. And so what I received from that was those risks that you have to take gets you to more opportunities, gets you to be able to grow in certain areas that you probably never had in your radar to grow in, or you thought maybe that you were, or maybe you thought that you excelled in that area of life, but quite honestly, you needed those risk-taking opportunities to challenge yourself. Even though risk-taking is quite scary, I think it is necessary for growth. I think it is necessary to step outside of your comfort zone at times, because you just never know, in those moments or in those decisions, how much of a benefit that can be to you long term. I came here on a whim. I didn't know anybody in the area. I don't have any family in the area, but I would say this has been the best decision that I have made so far in my life. And I think had I not took a risk, I wouldn't be here today. Thanks so much for listening to my story. If you have any questions, feel free to talk to your teacher.